For a country at the level of Nigeria's development, coronavirus is simply bad news. But the country has thus far been spared the anxiety of having to deal with the exigency of such a lethal disease. Same can also be said of countries in the same bracket as Nigeria. But while Mother Luck has so far been smiling on Nigeria, what happens then if by any chance the dreaded virus finds its way into the country? A few days ago, we spoke with the Director General of the Nigeria Center for Disease Control, Dr. Chikwe Ihekweazu, and he talked about a heightened form of interagency cooperation in the health sector that is designed to deal with a major disease like coronavirus. Well, joining us now for a comprehensive look at this subject is his counterpart, Dr. Gambo Gumel Aliyu, the Director General of the National Agency for the Control of AIDS. Dr. Aliyu is an epidemiologist and public health specialist who, until his appointment, was the chief of party for the Nigeria Indicator and Impact Survey. He also worked as the country director for the University of Maryland Health Programs in Nigeria. He's also an associate professor at the Institute of Human Virology, University of Maryland School of Medicine. Welcome to the program, Dr. Aliyu.
Good morning, sir.
Good morning. Dr. Aliyu, are you with us?
Good morning. Glad to be here.
Yes, thank you very much for coming to the morning show.
Yes, I'm with you.
Yes, quickly, would like to ask you.
Thank you. Happy to be with you this morning.
Thank you. On the question of coronavirus, is there interagency cooperation that you can tell us something about? And if there is, what is the level of that cooperation, the quality of it, and the processes involved? We'll start with that, but be assured that in the course of this conversation, we'll still talk about HIV/AIDS control in Nigeria. But first of all, let's talk about interagency cooperation to address this new global challenge.
Thank you. Yes, interagency cooperation always exists in the presence of an outbreak of this magnitude and in the absence of any outbreak. Agencies do cooperate, they do share information, at the same time help each other, especially in terms of capacity building and also providing experts where a particular agency is deficient, in its ability to address certain issues. But let me say this, for the coronavirus, I think the National Center for Disease Control is on top of everything. And the Federal Ministry of Health, especially the Ports Health Unit of the Department of Public Health, is also doing a great job. They have mounted surveillance units, and they are monitoring individuals that are coming into this country. And they are very careful in assessing individuals and the symptoms individuals display and where they are coming from. And at the moment, I think this is paying off very well. And we haven't seen any case here in Nigeria. And the monitoring aspect is going on, and is going on very well. Yep.
Thank you, sir. Now, it's been reported that doctors in Thailand and Japan have used antiretroviral drugs, which have been successful with HIV, that they have used that to treat patients with the coronavirus. Can you expand on this, and does this make you optimistic?
The anti-HIV drug you are talking about is the drug called Calitra. Calitra is a combination of two drugs, HIV drugs, which is ritonavir and lofinavir. And this drug has been found to be useful in prior cases of SARS and MERS. And because of that, some people are advocating, and of course, I think the Chinese government has started trial on it, treating patients that are affected with novel coronavirus with this medication, Calitra. Data are not very much available on it. We are still monitoring, and we are still waiting to find out how patients are responding. And of course, whenever there is such need here, we don't pray for it, but if it happens, yes, we will deploy such medications to ensure that people are well covered.
Thank you, Doctor. And now I'd like to take us into the recent data that we also have that's come out this morning, shocking a lot of people. We're now seeing that there are about 60,000 cases of COVID-19, the new coronavirus around the world. We're also seeing that 242 people died yesterday, which was double the number of the day before, making that the highest number of deaths in one day since the outbreak began. So clearly, the virus is becoming more widespread and people are becoming more worried. What sort of a risk situation are we in now in Nigeria? I know that we've stressed on the fact that the NCDC are doing their very best to keep us protected, but with the spread of the virus and the way in which it's currently spreading, what advice do you have for the Nigerian people and how safe do you really think we are?
Well, you know, Nigerians travel a lot, and the most important safety precaution measures at the moment is to ensure that people who visited China are totally quarantined. And if people don't have anything critical, they shouldn't travel at the moment. And those who are there should remain there, shouldn't come over until the outbreak is over. This is very, very important because the only source we can think of now of this virus is somebody carrying it from somewhere and coming into this country.
Well, Dr. Aliyu, there have been quite a number of myths about coronavirus. And I don't know whether, you help us to clarify whether those myths are actually real or something we don't need to worry about. They include the fact that, one, some people say that we have not had any reported case or confirmed case of coronavirus in Africa or in South America because, the virus cannot survive in the tropics. Is that true? Two, we've also been told that this is some kind of biological weapon, which is a fallout of, the conflict, the trade conflict between the United States and China. Is this true? Three, we've also been told that this is an invention by big pharmaceutical companies, to sell vaccines. All of this and so many other, conspiracy theories. Could you help us address these conspiracy theories for the education of the general public to confirm whether these are true or not?
What is true is that the novel coronavirus has not been seen in human before now. And generally, coronavirus are zoonotic viruses, which means they propagate and they populate around among animals, not humans. But occasionally, from time to time, they are seen in humans, like the one we have seen in the past. We've seen SARS several years back. We've seen MERS, Middle East Respiratory Syndrome virus, which is even more lethal than this. The prior to the MERS and SARS were more lethal than the current coronavirus because MERS had 35% mortality rate. SARS had 10% mortality rate. This one is having about 2% mortality rate. I doubt too much if there is anything like conspiracy theories. Sometimes those things do happen. And remember, if it were a conspiracy theory, perhaps probably it may not emanate from a food market in China where live animals and as well as slaughtered animals are sold. So that's where the virus emanated from, and individuals that were identified earlier were individuals associated or related or found to have visited that market. For now, there is no evidence to say that it's a conspiracy theory or it's being used as weapons of mass destruction or any sort of that. And the other theory that people are saying, it perhaps probably may be difficult for the virus to survive our climate. That is also not so at the moment. We haven't seen evidence for that. The best thing is to stay away from it and to take precaution measures to ensure that that virus is not imported here.
Thank you, Doctor. We're about to take a break now, but I just wanted to ask you, I'm not sure if I'll be able to finish this question. The largest outbreak outside China is right now on the Diamond Princess cruise ship in Yokohama, Japan. And the reports coming from there are quite disturbing. I'd like to take you through some of the statistics. The number of people who have tested positive has now surged to 175. Unfortunately, Japanese officials have only tested 439 out of 3,700 passengers on board, citing shortages of equipment. This means there could be some people on board who are positive and do not know. They're sitting in quarantine and they don't know if they're positive or not. There's also the situation where 10 crew members have tested positive because they were all eating in the same mess hall, all the crew members wearing masks and gloves, but eating in the same room, and they were still infected. So it raises questions on the efficacy of a mask and gloves, which is what we all hoped would keep us safe. And then there's also the case of the Japanese health officials who was doing the testing, who has become infected. So it's raising concerns about health workers. From the Nigerian perspective, what does this issue on the Diamond Princess tell us about this virus?
Wherever there is close contact and where people are packed in one place, the tendency of disease to spread across them or among individuals at that particular cycle, is higher than when people are widespread. And this is not unexpected because of the closeness. This is, of course, is not airborne, but it's also aerosolized. When the fluids of one individual, is shared, or somebody sort of inhale this fluid from a person that have this disease is very likely to be infected. But that said, even the figure we are talking about globally now, that about 45,000 people have been diagnosed with this disease and about 1,115 of them have died, is those that have been counted. There are a lot of them out there that probably have been infected but have not been counted because their immune system is able to take care of the virus, when it enters. Probably it had given them mild fever, mild cough, but it stops at that. Individuals who suffer most from this disease are individuals that have compromised immunity or weak immune system, or people who have disease of respiratory system that have been existing, before this infection, because this infection caused severe viral pneumonia that, if not taken cared properly, it could lead to death. But even individuals that are infected, if they had the initial supportive measures and the necessary support to keep their respiratory system working, they don't die.
Thank you, Doctor.
Yes, it's very likely to find such kind of thing. Yeah.
But on that positive note, we draw the conversation to a close. Thank you for joining us this morning.
Thanks, Doctor.